Living Well, brought to you by CHRISTUS Cabrini Hospital.
John Hall joins us today. He's Director of Cardiologists at CHRISTUS St. Francis Cabrini Hospital. May is National Stroke Awareness Month. How is the hospital commemorating this?
Hey Francis, indeed it is. And in May here at Cabrini, we're commemorating this most important month by really celebrating a recent milestone we achieved. We served our 100th patient with some great new technology called Telestroke, which is a form of telemedicine.
Okay, what does it do?
Okay, what it does is it connects us with Ochsner Health Systems down in New Orleans. This is the unit behind us. And I'll go back and kind of what really started it was that we realized about 3 years ago, we saw some statistics that just really were startling, that Louisiana has the 4th highest mortality rate in the country for people that have strokes. So that was a real community health need, both that the community needs to recognize stroke, and secondly, we as providers need to be able to respond as quickly as possible, providing the right technology and the right resources. And that's what telemedicine does, especially Telestroke. With this unit, it has a camera that we bring to the bedside. It has 2 video screens. We connect with an interventional neurologist, which is a really highly specialized neurologist. And you really only find them in the large metropolitan areas like the New Orleans or the Houstons. So we're connected 24/7 with one of those physicians with this machine.
Why is time of the essence when you're dealing with a stroke?
You bet. I think that stroke, more so than any other disease, is time sensitive. I think we as a community, we're real aware and sensitive to heart attacks. Like a heart attack, a stroke has, typically 90% of strokes, you have a clot that's impeding blood flow. When blood flow is impeded to the brain, you can have some really bad outcomes. So time is of the essence, and the window is smaller for stroke more than heart attack. So we're trying to get the concept across to the community that a stroke is a brain attack. And time is of the essence because we only have 3 hours.
Okay.
From the onset of a stroke, we have a 3-hour window to administer these clot-busting drugs that can get that clot out of the way and restore blood flow before there's permanent brain damage.
And folks need to understand that strokes can kill, but telemedicine is here. What do you want us to remember about telemedicine?
You bet. I think just remember that what this has done to our community is that it has connected us with a premier stroke program. Recently, Health Grades, which is the leading consumer rating agency in the nation for hospitals, rated Ochsner in New Orleans as the #1 stroke program in the state. Also, Cabrini was recognized as the 2nd best stroke program in the state, one of the top 100 stroke programs in the country. So what we can bring to Sinlaw and bring to the residents of this area is immediate access to a highly specialized neurologist and immediate access to the best resources available right here in Alexandria.
For more information, call 866-581-3627.